Hello everyone, welcome to my YouTube channel which has got pharma video content. These are my channel credentials. I have more than 80 videos uploaded, more than 1200 subscribers and more than 25,000 views. If you like my video, do subscribe, share and comment about the video. Now in this video I made GPAT 2020 questions analysis. I will provide you in-depth analysis, and in this video I have explained about pharmacology 10 questions with complete analysis. Please watch till the end. Now before getting into that, let us see how the questions patterns is there in GPAT 2020. In GPAT 2020 there were around 30 questions from pharmaceutics, there were 34 from pharmacology and physiology. From all chemistries, organic, medicinal and analytical chemistry, there are around 29 questions, and from biochemistry and microbiology there were 14 questions, and then cognitive there are 10 questions, and from jurisprudence there were 8 questions. In previous year, in 2019 too, the pattern is more or less similar. Now students understand this. These are the three important subjects: pharmaceutics, pharmacology, physiology and all chemistries put together. You will be getting around 90 questions. And for your knowledge, in 2020 the cutoff for open category was 163. For OBC it was around 141. And All India topper has scored 314 marks. So this is the statistics of GPAT 2020. Now let us get into the pharmacology question analysis. The first one is, which one is not an opioid receptor? See, the moment people start reading about opioid receptors, they will read about mu, kappa, delta receptors which are related to opioid. So kappa, mu, delta are opioid receptors, but which one is not means gamma is not there. This is a kind of direct question which can be answered by any student who knows about opioid receptor. So in GPAT you have questions which comes in this category, like there is a direct question related to either classification or related to receptor type, but most of the questions are concept oriented. Moving further, the next one, which of the following drug poses anti-platelet effects? Again, as I told you, this is a direct question which is about a classification. Drugs: Clopidogrel, Urokinase, Desomopressin Erythropoietin. Out of these four, Clopidogrel is an antiplatelet drug. Now if you see the Clopidogrel is a prodrug. It gets activated in liver with the help of cytochrome P450. The active metabolite inhibit ADP receptor type called as P2 Whiteful receptors, and inhibition of this receptor decreases platelet activity and thrombus formation. Hence it is known as antiplatelet drug. Students, let us know about the remaining drugs too. What is about urokinase? Urokinase, before understanding that, understand this process. See, the platelet clot is because of platelets, red blood cells and fibrin. Fibrin will ties all these platelets together and gives a clot. Now the fibrin, when the clot function is carried out, the clot will be degraded with the help of plasmin. Plasmin comes from plasminogen. Plasminogen, with the presence of activation, it converted to plasmin, and plasmin degrades fibrin. That results in fibrin degraded products and clot will be dissolved. Now this plasmin is activated by plasminogen activator, urokinase and streptokinase. So what is this urokinase? Urokinase activates plasmin, causes fibrinolysis. So the option, this urokinase is a fibrinolytic agent. Clear? Next, Desomopressin. Now Desomopressin is an analog of Vasopressin. Now what is the function of Vasopressin? Vasopressin is used to treat diabetes insipidus. When continuous urination, tasteless urine, insipid means tasteless, the watery urine discharge is increased, that disease is known as diabetes insipidus. Now let us understand what happens in the lumen of collecting tubule. Here all the urine formation will be there. Now from here water will be reabsorbed into the body through the cells with the help of aquaporins. Now these aquaporins are activated by vasopressin. Vasopressin is also known as anti-diuretic hormone. Why? When vasopressin activates aquaporins, water will get reabsorbed into the body, so diuresis will be reduced. That is the reason why it is called as anti-diuretic hormone. The problem with vasopressin is, as the name indicates, it presses blood vessel, increases blood pressure. To avoid that, Desomopressin is made, and Desomopressin is an analog of vasopressin which increases water reabsorption with less vasopressor activity. So this one, Desomopressin, is used to treat Diabetes insipidus. What about erythropoietin? Erythro means red blood cells, poiesis means generation. Now see, this is what happens. During anemia and low blood concentration, a signal goes to kidney, and kidney secretes erythropoietin, which increases red blood cell formation. So this process is called as erythropoiesis. So what is the function of erythropoietin? It increases red blood cell formation. Next question. What is the mechanism of action of the drug Lamotrigine? See, Lamotrigine is an anti-epileptic drug. The question itself says it is an anti-epileptic drug. You need to find out what is the mechanism of action. Inhibition of calcium channel, inhibition of sodium channel, blockade of NMDA, inhibition of glutamate. Now, Lamotrigine inhibits sodium channel. See, basically the anti-epileptic drugs has got this classification. There are drugs which will inhibit sodium channel, there are drugs which will inhibit calcium channel, there are drugs which enhance GABA transmission, and there are drugs which will inhibit excitatory amino acid neurotransmitters. Now, see, in the epilepsy is because of hyperexcitation of CNS. The job is you need to reduce that excitation. You can do it by blocking the channels or by enhancing inhibitory neurotransmitter or inhibiting excitatory neurotransmitters. Now, in this, Lamotrigine belongs to this sodium channel blockade class. Now, look at the difference. The previous two questions were completely related to just what kind of drug is that or what kind of receptor is that. Now, this is about mechanism of action. So, first level is a direct questions which are related to mechanism or its class. Now, the next level is what kind of mechanism of the drug is that. Now, moving further, see, antifungal agent 5-fluorocytosine is converted to its active metabolite 5-fluorouracil by one of the following enzyme. See, everything is related to cytosine. Cytosine demethylase, deacetylase, deaminase, reductase. Now, in order to answer this question, you need to know what happens with this 5-fluorocytosine. See, this 5-fluorocytosine is converted to 5-fluorouracil in presence of enzyme cytosine deaminase. It happens only in fungal organism but not in human beings. Look at the structure. This is a pyrimidine ring, and in that the cytosine has got amine and oxo groups. Fluorine is present at 5th position. Now, when this amine is removed with an oxo group, it becomes uracil. Now, what is the function of this uracil? This 5-fluorouracil inhibit uracil monophosphate and thymidine synthase enzyme, thymidylate synthase enzyme. Understand this process. What happens in fungal cell or in human cells is the deoxyuridine monophosphate is converted to deoxythymidine monophosphate. In DNA you have thymine is there, in RNA you have uracil is there. The difference is a methyl group here. Look at the structures. Everything is same here and here, only the difference is this methyl group. Attachment of methyl group occurs with the help of tetrahydrofolate derivative. So the whole process occurs with the help of enzyme thymidylate synthase. So the conversion of uracil to thymine occurs in the presence of tetrahydrofolate and in presence of enzyme thymidylate synthase. Now, 5-fluorouracil is very structurally similar to this uracil. Because of structural similarity, it inhibits thymidylate synthase and inhibit the conversion of forming thymidine. If thymidine is not formed, DNA formation will not be there, cell growth will not be there. Now, the advantage with this drug is this cytosine deaminase is only present in fungal organism. So, this specific conversion occurs only in fungi and it shows its inhibitory actions in fungal organism. Whereas, if you take directly 5-fluorouracil, it will inhibit human thymine conversion too. That is the reason why 5-fluorouracil is one of the anti-cancer drug. You know, methotrexate is acting here. It is inhibiting the active conversion of tetrahydrofolate. 5-fluorouracil is inhibiting this enzyme. So it needs both of them, folate as well as the enzyme. So this is the pattern. So what is that enzyme? Cytosine deaminase. See, instead of learning what is answer, you need to understand what is the concept. Then you will get command over the subject. Now, next one, which of the following is not a property of osmotic diuretics? You know, osmotic diuretics, they do not bind with any receptor, they just show their action because of osmotic property. They are relatively inert pharmacologically. True, they do not have any pharmacological action. They inhibit carbonic anhydrase. No. See, what does this statement says? They are inert. Inert means they should not have any pharmacological action. And this option says it has got activity, and this is not true. They are freely filtered at glomerulus, right? They undergo reabsorption by the renal tube, true. So this is what is the answer. This is not the property of osmotic diuretic. When there are multiple options with this kind of questions, you need to take time, think about it. If this is true, this one automatically becomes false. So you need to think like that. Next one. Now, d-tubocurarine produces skeletal muscle relaxation by inhibiting what? Tubocurarine is a very good skeletal muscle relaxant. See, the question itself says it is relaxing skeletal muscle. That means it is blocking skeletal muscle receptors. Alpha-adrenergic receptors? No. Muscarinic receptors? No. Ganglionic nicotinic receptors? No. Nicotinic receptors in neuromuscular junction. See, the question itself says it is a muscle relaxant. So the receptors present at the muscle are being blocked. Now, don't get confused with this nicotinic receptors. Nicotinic receptors are present on ganglion as well as neuromuscle junction. Skeletal muscle relaxation is bring about by blocking the nicotinic receptors at neuromuscle junction. So the answer is this one. Next, see, this is a kind of big question. You need to spend some time, think about it. See, which three of the following are physiological effects of ganglionic stimulating agents? Understand the concept of ganglion. Let us see about ganglion and then come back to the question. So ganglion is a relay center between a preganglionic neuron and postganglionic neuron. This one is ganglion. Ganglion is nothing but collection of cell bodies outside CNS. What is CNS? Brain and spinal cord is CNS. So outside the CNS, if you have collection of cell bodies, that is called as ganglion. So the ganglion is a relay center in sympathetic system as well as in parasympathetic system. Now, what is the middle one? See, adrenal medulla has got a single neuronal innervation without any ganglion, and that stimulation results in the release of epinephrine and norepinephrine. So this is what happens in sympathetic and parasympathetic systems. Getting back to the question. So the question is about what happens with ganglionic stimulating agents. Now, stimulation of sympathetic ganglia and adrenal medulla leading to cardiovascular response. Look at this. Adrenal medulla. Do adrenal medulla has got a ganglion? No, there is no ganglion here. So wherever you see option A, it is not correct. So option A you have in here, you have here. So you need to eliminate like this. The moment you see that, no, this is wrong. So both of them are gone. So you need to think about only two options. In both of them, B is there. That means B is definitely true. What is that? Initial transient stimulation and then a more persistent depression of all autonomic ganglia. See, the ganglionic stimulant, initially they cause stimulation and then persistent depression is there. So this is definitely true. Now the next one. Marked depression of CNS leading to analgesia. So what B says, transient stimulation but persistent depression. When there is a persistent depression, what happens? Marked CNS depression and leading to analgesia. If B is true, it indicates C is also true. Where do you have B and C? So this one is correct. Look at them. From the answers, from the choices, you can pick the answer. Now, what else you have? It says E. What is E? Combined activation of parasympathetic ganglia and cholinergic nerve endings by nicotine results in increased tone and motor activity of bowel. True. Look at them. See, parasympathetic activity, they have activity on this bowel and intestine, and that is what happens. So what happens with this? Option 2 is correct. Now, when there is a question with multiple options with long sentencing answers, you need to think logically. If this statement is correct, it automatically says, see, if this statement is wrong, if A is wrong, you need to eliminate all of them. Whichever the option has got A, you need to eliminate it. Now, B, it is true because the remaining rest of the questions you have B is there. If B is true, it indicates C is also true, and this one qualifies for the answer. Think logically, you can answer it. The answer is in front of you, you need to think about it. Moving further. Now, one of the following statements with respect to carbochol is not correct. Identify it. What is carbochol? Let us look at them. See, carbochol is a derivative of acetylcholine. So this is acetylcholine. The problem with acetylcholine is it is an ester. The duration of action of acetylcholine is very short because esterases will break this bond and they will be very short acting. To avoid this problem, methacholine is synthesized. What is methacholine? Attachment of methyl group here. What is the function of this methacholine? The moment methyl group is there, steric hindrance for esterases occur and they will increase the duration of action. So comparative to acetylcholine, methacholine has got slightly increased duration of action. But this is not enough. Again, Carbochol is prepared. What is this Carbochol? You have this particular group is there. The job of this group is, see, you have electrons here and electronic movement occurs, and this is how the resonance structures occurs. And this electronic movement stabilizes ester bond. So esterases cannot immediately break this bond because of these resonance structures. What happens with that? Duration of action increases. Now, bethanechol is a combination of both the alterations. Both of them are methyl group and this one is attached. So this one, duration of action is even more increased. This is what is a SCR is, structure activity relationship. So this is about acetylcholine analogs. Now the question is about what is not true in the following options about Carbochol. It possesses both muscarinic and nicotinic actions. True. It is like acetylcholine derivative, so it has got muscarinic as well as nicotinic actions. Now, it is more susceptible to hydrolysis as compared to acetylcholine. Look at them. See, we made these alterations to increase duration of action. That means less susceptible to hydrolysis. But what it says more susceptible. No, this is not correct. Next one, the amino group decreases electrophilicity of the carbonyl group. This is true. This is what happens. This amine group is reducing the electrophilicity of this carbonyl group because of this resonance stabilization. That is what is increasing its duration of action. And finally, it can be administered orally. Yes, it can be administered orally because the duration of action is increased. So which one is wrong out of them? This one. So in order to answer this, you need to know how the SCR is developed, how the compounds has got some chemical changes that has increased their duration of action. Right? Clear? Yeah. Moving further. Now, Cotrimoxazole is a combination of trimethoprim with sulfamethoxazole. The drug itself says it is a combination. Co means combination. Trimethoprim oxazole is from sulfamethoxazole. Now, which of the following statement is correct about Cotrimoxazole? Now, look at them. The most effective ratio of trimethoprim to sulfamethoxazole in plasma is 20:1. No, it is in fact 1:5. So if 20 mg of trimethoprim is there, 100 mg of sulfamethoxazole is given because 1:5 concentration is the best combination. 20 parts of trimethoprim is very toxic. It is dangerous. So this is not correct. This is wrong. Now, clotrimazole is contraindicated during pregnancy. True. It has found that it may cause fetal and abnormalities when it is given to pregnant women. This statement is correct. Next, clotrimazole is ineffective in treating respiratory tract infections. No, it is used to treat pneumonia, bronchitis kind of condition. So it is used to treat respiratory tract infection. It is effective in fact. Now next one, trimethoprim sulfamethoxazole are administered in a dose ratio of 5:1. Look at them. This is a very confusing concept. The fact is it has to be given in 1:5. Trimethoprim is 1 part, sulfamethoxazole is 5 parts. The ratio is reversed. This one will confuse some of the students. If they don't know exactly what is the proportions, they will get confused with this one. And they may opt for this, which is not true. So you need to be very careful about this kind of things. The options are given purposely to confuse the student. So which one is correct among all of them? This one. It is contraindicated during pregnancy. Next one. Now see, which of the following is not one of the triad effects of adrenaline leading to rise in blood pressure? See, adrenaline is a hormone released from adrenal gland. The release itself increases blood pressure, but we need to figure which one is not one of the effect. Say a direct myocardial stimulation that increases strength of ventricular contraction. This is what? Positive inotropic action. This is there with adrenaline and noradrenaline. So this is true. Now, vasoconstriction in many vascular beds, especially precapillary resistance vessels, this is true. It acts on alpha-1 receptors which are present on blood vessels and causes contraction. Next, stimulation of presynaptic alpha-2 adrenoreceptor. These are autoreceptors. And this autoreceptor, what do? They cause negative feedback inhibition. Because of this negative feedback inhibition, adrenaline and noradrenaline levels are reduced, and this will not cause increase in blood pressure. So this is not one of the effect which will increase the blood pressure. No. What is the last one? Increased heart rate, positive chronotropy. True. It has got positive inotropy, it has got positive chronotropy, and blood vessel constriction is there. But which one is not true? The presynaptic alpha 2 adrenoreceptor stimulation. This is not true. So these 10 questions which I have discussed, you need to understand the level of complexity. Direct questions, concept related questions are there. In the next videos I will explain the remaining questions. If you like the video, subscribe the video and share with your friends. Thank you.